Hi, it's Jen from Reform Physical Therapy and Pilates in downtown Cleveland, Ohio. We've been talking all week about plantar fasciitis, and while most people come in complaining about foot pain, like pain in the base of their foot, especially in the morning when they first get out of bed, a lot of times the problem with some soft tissue is actually in the calf. So when people come in for therapy to be treated for plantar fasciitis, I almost always go after their calf first. And one of the ways I do that is using these instruments. It's basically instrument-assisted soft tissue work. It comes in a lot of brands. This brand is actually Hawkgrip. And you use it to sort of create a new kind of acute inflammatory cascade in the muscle. So a lot of times with a chronic issue like plantar fasciitis, it's become stagnant, so it's not healing on its own. So you want to sort of bump up the system and help it heal faster. So what you can do, you take the tools. It's not the most comfortable process in the world, but you just kind of go over the tissue where you think there might be some restrictions, whether that be in the fascia, deeper in the muscles where there might be some trigger points. So you kind of rake over it, looking for those areas that might be responsive to the tools. And you'll see some redness. The patient usually feels some bumpiness in the tissue. And once you find those areas of restriction, you can use the other tools, they come in different shapes and sizes, to sort of dig into those areas where you think there might be a little bit more of the root of the problem. So the big problems usually are right here in the middle, where the two muscles of his calf come together, his gastroc and his soleus, and then also a lot of times on this outside portion where people will get a lot of tightness. So you'll use the tools, get into the muscle, kind of get some good blood flow and healing to that area, and a lot of times that helps the foot feel a lot better. We have a lot of other tools we use for therapy when it comes to plantar fasciitis. This is just one of them. If you have any questions or you've been having problems, let us know and we'll try to help you out. Thanks.